The University of Pennsylvania is sparking backlash after nominating transgender swimmer Lia Thomas for the NCAA Woman of the Year award. And you'll remember, Thomas earlier this year became the first transgender athlete to win a Division I title after recording the fastest time of the entire season in the 500-yard freestyle event. And former Kentucky swimmer Riley Gaines, who finished second to Thomas during the NCAA championship, is one of the many female athletes outraged by the decision, calling the move yet another slap in the face for women and arguing that the NCAA has made this award worthless. However, female athletes did get a win this week when a federal judge temporarily blocked the Biden administration's directive allowing transgenders to join sports teams that correspond with their new identity. So what does this all mean for the future of women's sports? Joining us now to discuss is orthopedic sports medicine surgeon at Mount Sinai Hospital and Team USA physician, Dr. Robert Parisian, who was also a team doctor for UPenn. Dr. Parisian, welcome back to the show. Good to see you this evening. All right, so Lia Thomas came in first in the 200, the 500, and the 100-yard freestyle events at the Women's Swimming Championship earlier this year. Her time in the 100 and 200 freestyle competitions, they are shattering previous records for the pool, for the league's competition records. So if biological males are allowed to compete in women's sports, what does this mean for the future of women's sports? I mean, can a biological woman even beat these new records?
Thanks for having me this evening. So it's a great question. So when we look at this, we look at a biological male versus a biological female. And biological males, we do know, especially the ones that went through puberty, have an advantage, and largely it's based on testosterone. And so what are some of those advantages? Well, those advantages are generally a larger stature, generally increased muscle density and increased strength and stamina. That can be beneficial for different lifting events or stamina for different length events, such as swimming, for example. Another one, and a couple of the most important ones that biological males have an advantage over, is oxygen carrying capacity. So that is the body's red blood cells producing oxygen and delivering that to the cells of the body and to the muscles. And so anytime you have a biological male that's competing against someone that's a biological female, they're going to have an advantage. Now we get into testosterone suppression when you talk about these various sporting organizations. And I think the major challenges right now for all of these sporting organizations is really to find a way to promote athletic inclusivity while also still maintaining and ensuring that competitive equity.
So just last month, we saw the International Swimming Federation come out and say that transgender women cannot compete as a woman in the sport if they have already experienced male puberty. All right, so this seems maybe like a win, but does this new rule, where if an athlete completes their transition by the age of 12 or before puberty, does that even the playing field for women?
Well, that was the attempt. And so we've had several organizations throughout the years, the IOC, the International Athletic Committees, and several others that have gone and they have based all of their decisions either on a time of suppression of testosterone, because again, that is the major contributing hormonal factor in males, to be about a year or 36 months. Others have said down to, and I don't want to get too scientific here, but down to 5 or 10 nanomoles, for example, per liter. Well, the average cisgendered woman has less than 2 nanomoles per liter. And so you're still not necessarily quite getting down to that level. So the recent threshold by the International Swimming Federation was to say that if you transition pre-pubertal, then we will allow you to compete as a transgendered athlete against other females. But if you transition post-pubertal, you will have all of those built-in advantages of puberty and the effects of testosterone on a biological male body post-puberty. And so, really, what we're seeing is that. And again, we don't have enough data at this point in time in elite transgendered athletes, but this is their attempt by setting that pre-pubertal stage.
All right, I only have 30 seconds left, but do you think this is incentivizing athletes to transition before they're at puberty, before they're 12? Are you concerned about that?
Well, you have many, transgendered individuals who would be probably the first ones to say that going through that process and that that transition was a challenging one to come to. And so now, if you're putting that age limit below 12, you're going to have very difficult decisions for families and very difficult decisions for very, very young children and athletes, age 6, 7, 8, and 9 years old. And you can foresee potentially a family looking at that scenario and saying, I wonder if we need to transition now so that our son can then play as a transgender, to compete as a transgender female, but we have to do this prior to age 12. And so, I guess we'll see that as we move forward with this new regulation.
A decision that a 12-year-old shouldn't be forced to make, shouldn't be encouraged to make. Thanks, Dr. Parisian. Always good to see you.